Go ahead. Thank you so much for joining us today.
Absolutely. Thanks for the invitation. So for those that don't know me, I work for the California Office of Emergency Services. I have the responsibility to manage the 911 network for the state of California. And I do a couple of other things at the Office of Emergency Services. I'm what's called the statewide interoperability coordinator. So I'm coordinating radio interoperability between agencies throughout the state. And then during disasters, I oversee emergency support function 2, which is communication. So a lot of heavy technology interaction, interoperability, that kind of stuff. And so when this 988 initiative began, we took a look at the analysis. There was some legislation introduced about a year ago, about a year and a half ago. And we took a look at it from a technology perspective. Since then, we've been actively involved in numerous conversations regarding this. And these next couple of slides that I'm going to go over, I'm going to share my screen here. I just want to give you a sense of kind of where we are. I see there's a lot of, there's a diverse group of folks that are on this call, which is super exciting. And what I really hope to do is stimulate some conversation. So if as I'm going through this, you have a question, pop it in the chat window. I can address it immediately. Raise your hand, whatever you want to do. I really want to make this interactive, especially on a Friday afternoon at 1:30. We probably all have the post lunch blues. So feel free to interrupt me at any time if you want. So I'll go ahead and share my screen just to give you a sense of, this is the overview of what I'm going to be talking about a little bit about. And like I said, I hope we get some good questions, because I really think that there's a lot of room for conversation in this space. So I've got the chat window open and I'm looking at it. I'll start with some statistics, those from the 911 community that are on the line. You've seen these before, but I just want to help kind of level set where we are in California. We get about 27 million 911 calls a year, by far the largest in the nation. The next closest state is we're about 19 or 20 million. So we're large, and we're the largest by far. 95% of all 911 calls are answered in 15 seconds or less. That's even with our existing some staffing challenges that we have that I'll cover later. Our average call length is about 100 seconds. So in the 911 space, we're really focused in on connecting the right resource to provide the life-saving, help needed during that time of emergency. So
give you a heads up that I had to
somebody might need to go on mute. We hear some background there. There's 438 public safety answering points in California. I don't have off the top of my head how many are in Alameda County. Somebody on the line may know, but it's a significant number. And obviously the Bay Area has quite a few as well. We route calls automatically to every single PSAP based on the location of the caller. So we actually know the location when they call 911. And one of the questions that was sent to me was about funding and available funding to 911. We're funded out of what's called SETNA, or the State Emergency Telephone Number Account. A fee is assessed to every access line. So this is wireline, wireless, and voice over IP. And then that fee is remitted to the Department of Fee and Tax Administration at the state level. And then it gets deposited in this fund. We set our budget each year, and then we set the rate to ensure we have the funding needed. So the very, very good news in this whole conversation is that from a 911 perspective, we have the funding and the resources needed to be successful. The governor's budget just passed, and in that budget, there was also a set aside of funding to support 988 call answering equipment, and the small amount of staff we need to procure that and get that rolling out. So I'll talk about that a little bit, as well as what's coming. So we do have some funding for 988 specifically for answering 988 calls. All right, so not seeing any questions, I'll move on. This graphic we used when we were having our initial conversations about upgrading our 911 system. And it really is supposed to show the different technologies that are out there. So regardless of whether it's a landline, a wireless call, voice over IP, or text to 911, those calls come into our 911 system. They get routed based on location to the right public safety answering point, and they land at equipment that we call processing equipment or customer premise equipment. You'll also hear the term call handling equipment. It answers the 911 call. It's what it does. And we track statistics and metrics and everything else associated with those calls. The next piece in the puzzle is that we actually dispatch somebody to that location to provide that help in a large majority of the time. Certainly not every 911 call is a direct correlation to a response, but a very large number does. We use a software program called computer-aided dispatch to do that. It dispatches the resources and the interfaces with a computer that's mounted in each of these vehicles out there. And we do exchange some information between the 911 call answering equipment and that computer-aided dispatch. We talk to those folks out in the field using what we call land mobile radio. So it's the push-to-talk radios that you've probably all seen where they're like leaning over into their mic and all that kind of stuff. That radio system is what they use for mission critical voice communications. And then a lot of our 911 centers can become involved in alert and warning. Since they're a 24/7, 365 operation, a lot of times they're involved in that. And if it's not them, then it's the emergency manager working in conjunction with the local alerting authority to do that. But it is a different system. And so it's designed to send information back out to the public using a variety of means. So this is everything that, well, just a small subset of what's in the 911 center, but gives you kind of an idea of the different technologies that exist and helps you to understand the kind of resources you might be interacting with if you're coming from a mental health or crisis prevention side of the equation. So any questions on that before I go on?
I have a question. We had talked previously that the 988 technology doesn't do this very same thing that a 911 call does. So if I call in from a 650 number, but I'm actually in the 408, it's going to send me to a 650 988 located. If the call came through 911 first, will they still make that distinction that the location is where they'll really attach them to the 988 receiving? Am I making sense on that last part?
Jennifer, 100% making sense.
Okay.
And the bad news is no. So if we get a call into 911 today, unless we make a change, and I hit transfer to 988, when it goes into that 988 system, they still route based on area code. So that call would be routed based on area code. Now, we do have the ability, and I'm going to talk about this in just a minute, a couple slides, with where we want to go and where we are going with this technology. We could program in the 911 call handling equipment, the direct transfer to the crisis center that 911 center should transfer to. And
yeah, that's what we want here in Alameda County to do, not to send people to 988, to give them a direct line to us. So we actually specifically know it's coming from a 911 center.
Exactly. And what we want to talk about as we move forward in the technology, what other information would you like about that call? And what other information can we share about that call? Because those are sometimes two different things. You know, the information you have versus what you can share. And so that's part of our conversation that we need to have. But we totally understand the need to transfer to the local crisis center. And in some cases, that's not even a 988 center. Like we've learned in Nevada County, for example, they have a very robust local crisis response capability, and they're not a 988 center. So in that county, it might make the most sense to transfer them to that local resource and not even send them over to the national number. And we're aware of that. And we just, through these conversations, have been learning these details that are really so important to getting the right response to the right location to make sure that you're meeting the need that exists. Yeah. Okay, so some acronyms on here in case you wonder. I put those on the slide. You'll have access to the slides. Now, from the 988 perspective, this is the numbers that were given to us. So if they're not accurate, this is what we know. There were about 1 in 8 calls nationally were really California related. So we have a large percentage of the call volume nationally, which we understand. There's 13 Lifeline call centers in California, and there's additional crisis response centers that exist that are not Lifeline call centers. There were about 300,000 calls, chats and texts in 2021. So you compare 300,000 with 27 million. Obviously, there's a big difference there in call volume. The good news there is that we don't anticipate, from a technology perspective, any impact on 911 as a result of 988. We can flux and we could get we could probably get 10 million more calls with the technology we have in place. Now, those answering the calls and the staffing and everything else, that's a different story, but the technology itself is not going to be the snag here. The answer rates are very different. I don't know if you know your stats in Alameda County, but it's anywhere from 52 to 98%. So you compare that. What's not in that stat is sometimes there's a long hold time associated with before that answer. Okay, so you're about 80%. So our goal, 95% answered in 15 seconds or less, quite a big difference between the two. And I'm going to talk about operationally what we're hearing from our 911 centers in relation to that. And then, the goal is to reach that 90%, where right now the average is about 83 in the state. So this is the picture as we understand it. And please correct us if we're wrong, if this doesn't match how your center is set up. So text and chat come across the Vibrant provided solution that's separate and independent, that you have to log in and establish a queue and you're there. Okay, so that's how you're. And then 988 calls are routed based on area code. So your center is associated with a certain number of area codes, and those get delivered to you across a connection, and you probably have a local, what we call a PBX, some kind of IP-based switch or something that you're answering those calls with.
Yeah, they have a 0.2 number, and like they send all the 988 calls that come from 510 and some 925, which I don't know how it's determined, to us in Oakland.
Well, the good news is they're not sure how it's determined either, because we've asked them how that's determined and they're not able to share that information with us. So that's quite interesting. But that's how the call comes in, and then you integrate it into whatever you're using for a call handling platform or a call records management system. And there's a lot of different terms there. What we want to know and understand in order to really get this right is, if we've been given the funding and authorization to buy you call answering equipment to put this in place. What do you want it to do? What information do you need it to store? What other downstream crisis management type resources and data sources do you need to support so that we can make sure we feed you the data needed? And in today's world, when a call comes in 988 and it needs to go to 911 over here, you basically have a 10-digit number that you then transfer to. And that same 10-digit number is the one I call to complain to the police department that somebody bumped into my trash can the night before, or, I have a noise complaint, or I have this. It's not an emergency number. And you could end up waiting there if there's a huge number of 911 calls that are presumably emergency, when the reality is your call is already guaranteed to be an emergency because you've already triaged it. But yet your only path into 911 is that 10-digit number. And we're going to address how we're going to potentially solve that as we deploy new technology. And then we do know there's a lot of pilot projects out there for joint crisis response. I don't know if Alameda County is doing any of them, but there's a lot of good work doing in this space for sort of a joint response type model. And I don't know if you guys have any of those programs in place.
Yeah, there are a number of programs in the room that do a joint response between a mental health agency and either fire or police.
Okay. And I was just in New Orleans at an event called Transform 911, which if you have not been on their website, transform911.org, they have a lot of interesting and what I think will eventually get a lot of traction. But I met with the city of Albuquerque, who's got an interesting model for how they do a joint response. And the number of response teams they have and how they're doing those resources. So this is kind of a landscape of the architecture as we know it today. And we think there's some dramatic improvements that can be made in this space. So one of the things that we know is July is here and 988 is going to be a thing in what, 15 days? Is that what it is? Okay. So like it or not, 15 days from now, and actually even now, if you do 988, it's going to happen. Okay. So question from overlapping zip codes, how will those be routed? So Rosa, with 988 call routing, there won't be any initial change based on the way that 1-800-273-TALK is routed today. The only difference being the access into the system, you'll be able to get access via that 1-800 number or just simply by 988. But the rest of the backend technology, routing and all that stays the same initially. So it's already been predetermined. And as I said, we're not quite sure how they determine which area code should go to where, but it is happening today. So we know in the PSAP side, there was some confusion. Our 988 call is going to come directly to PSAPs. No, the existing mechanisms would stay the same. If a 911 call comes in and it's supposed to be for mental health, is there some statutory requirement either at the federal or state level to make that transfer? No, that has not happened yet. So local policy will dictate that. Whatever local mechanisms you have in place for determining how to transfer that call, those will remain in effect until either updated policies are made at the local level that are informed by some of the information we're gathering, or there's a change in statute. There is a bill, it's called AB 988, that does have some information in it about this, but that bill is still being debated, and I could not tell you the fate of that bill, but there is some information in there. One concern, and I kind of mentioned this, so if a call came into 911 and the determination was made that, you know what, a behavioral health resource would really be better suited for this call, and we go to transfer that call over to you from a 911 center, and there's no resources available, or there's a long hold time, what do we do? Because remember that the world that call is being transferred from, in less than 15 seconds, they answered the call. And the call typically only lasts about 100 seconds. And they're all about getting the right resource for this person. And they've got more calls coming in where that same need exists. So this is an area, you know, that technology can facilitate the transfer easily. But if there's no one there to answer the call and you can't do that warm handoff that you'd like to do, what do you then do? And I think that's probably where some additional conversation is needed at the local level to say, what do we do? How do we help in that situation? And inevitably in today's world, that probably means the 911 center will keep the call and try and handle the call. In most cases, again, that's a local decision. It's not something OES is pushing or the state is pushing. It's just a reality of kind of where we are. And there's a lot of questions about standards and trainings and policies and accreditations and all this. Those are in their infancy. I've been on a lot of the SAMHSA calls. I've talked a lot with mental health professionals throughout the state and with the state Health and Human Services and everything. And this information is really under development. So it's one of those things where there's a lot of work yet to be done here. The big takeaway is that on the 16th, other than the way you access the system, no big changes. And then we're going to hear how that goes. How does that impact your staffing? Are you seeing a huge influx in calls? And remember, I won't know that unless you tell me, because there's no active system monitoring or no feedback mechanism to the state to tell us in real time or even near real time, call answer times, call volume, those kind of things. So really interested to see what happens and how your staffing levels and technology is impacted by this. So question here, will caller demographics collected by 911 dispatcher be shared and given to the 988 counselor? So great question. Depends on the policies you have in place at the local level. I think the bigger question I have from a technology perspective is, what information would you like to know? And then we can answer the question, is there a way to facilitate sharing that information? And that's really what we're trying to do, because I'm going to write with the funding I got from the state legislature, from general fund for 988, we're going to write a requirements document and get a technical solution that has the ability to do whatever's needed operationally. It's those requirements I need, so I can write them in the document so that you tell me when you're at 911 and you push that call to 988, I can get it to the right center. We know how to do that. And this is the information we would like delivered with the call if it's known. And then we will work together to determine the protocols or best practices, which is about all we can do absent statutory authority, of how you facilitate that transfer. And then from there, that would be like a guidance document passed down a local level. Then you guys are going to tell us how bad we screwed it all up, and we'll fix it and we'll update it, and it'll be a living document. And eventually we'll settle on some guidance that really answers the mark here. And so I think that's how this will be facilitated initially. So the question that we have, and if you have time to gather that data, what information would you like? And then we'll see if there's a way to get it to you. So some other operational considerations. We have many of our PSAPs that are understaffed, not all of them, but many, which means they're overworked, and an increased call volume, is challenging. If there's a plan in place and agreed upon mechanisms, the feedback we're hearing from our PSAP community, and we have many of them on the call, so if I'm out of line here, let me know. But as long as there's a policy and procedure in place and how this happens, they're extremely supportive, extremely supportive. It's just having that agreement on how this transfer is going to happen, under what conditions, and how it's supported, really is going to be the key. And we know there's cities and counties that already have this all worked out, and you might be one of them. This might not even be a thing that you're concerned about, but it's just, that's important. We know that there are some cities and jurisdictions out there that are not even 988. And so how are they going to be impacted by this if they don't even have a crisis center, but yet they have a mental health response capability? And how is it going to be superseded by 988, augmented by? And I think that's a question that we have to get through. And then, like I said, we don't know if there's staffing gaps and shortfalls and stuff down at the 988 centers that are yet to be in place. We do have standards for 911 calls. There's some concerns about these wait times, and we're really looking for AB 988 has some guidance at a high level on transfers between 911 and 988. We'll know by the end of August if that passes. If it doesn't passes, then there's no statutory authority in place to do this. So we end up in this challenging position where, what do you do when you want to make that warm handoff? Is there a liability issue? Is there a information sharing limitation? Those kind of things. So really more to come on this, but these are just some of the things we're hearing. So I'll pause here and see if anyone else has anything that they want to chat about related to this.
I was just thinking how sample like MOUs or things like that would be really helpful in kind of facilitating these conversations, so that, I don't know, the whole state doesn't end up with a further fragmented way of doing things. So like, we have many jurisdictions in Alameda County, and if nothing else, I would like to have the same protocols with all of them. So we're not teaching our staff to treat those calls differently, and they're not having to teach their staff like 10 different things. So like uniformity, if I had one ask, would be uniformity.
Yeah, so we've got data available from the state of Minnesota. They have a really good protocol in place. State of Virginia has a state level protocol that's in place. I met with City of Albuquerque, City of Tucson, City of Atlanta. who all have pretty advanced programs. There's the pilot that Dee Hirsch is running down in LAPD and LA County. We've met with Wellspace and the work that they're doing and the protocols they have in place. So from there, what we're going to do is we're going to come up with a skeleton of this is probably a good baseline. And then we want to message that back out to the community to see where we've missed something or where we've included something that is too specific and you need more local flexibility. And how do we get that right? Because obviously at the state level, if there's no law that passes, we have no authority to do this. But to coordinate it is an absolute requirement. So we have a limited amount of staff that we can dedicate to this. And I think if we partner with you, I think we're going to be able to really get something where at least we have the opportunity to do it in a uniform way, giving enough flexibility down to the local level to make this happen. Okay, so another question here. It says, if there's a call that has to be transferred to a 911 dispatcher for emergency procedures, is it possible to share outcomes? Contact made, taken to ER, no contact made. I think that's possible, but in general, the 911 center is primarily focused on getting the right resource to the right place at the right time, not necessarily documenting the outcome that was achieved once that resource was delivered. So there may be some gaps just in the way data is stored and captured, but that's a good takeaway. So we can certainly put that capability into the system that once the call's made, the system can exchange the data, but that'll only be supported if both ends have the technology to share that information. So, but that's a good takeaway. Thank you, Tia. I appreciate that. Okay, any other questions? Just a couple more slides here. So we think that certainly there's some work to be done at the FCC level on location information related to 988 calls. It's been a topic that has been discussed a lot. There are some challenges in that there is there is absolutely the expectation that anonymity is possible when you call 988. So there's a way to solve that. We can use location to route the call and not disclose the location when we display the call. So location is used to route, but you as the call taker don't know that location. So that's one thing that we've talked to the FCC about that would definitely solve that. And then some way to get consent. Now in the 911 space, the way that happens is, that user agreement you get on your phone that you never read, that thing you just scroll through and you click I agree and you move on. You've just given consent, and when you call emergencies, you can get your location. And there's statutes in place at the federal level that provide, exigent circumstances and you get location. So those exist in the 911 space that sort of solve that problem. That does not exist over a 988 and arguably shouldn't in certain circumstances. But knowing the location for routing and then suppressing that location from being known could be a really good way to solve this. And then once consent's given, to use that location if needed. Obviously, if you're going to put in a mobile crisis response team, you need to know where to respond to. And at that point, you're going to need to know the location. But you could still suppress other personally identifiable information and just simply use the location. And so that's another thing that we've talked through the FCC about. So a lot more conversation, I think, to come on this. It's the federal government. They don't move fast. This is something on down the road quite a ways. We've also got some supplemental tools that with consent, you can push a link to a caller. They click the link and location is returned. That could be done supplemental if there's a need to know location, but that doesn't solve the routing problem. That just lets you know where they are once they're into the system. And we know that. Federal legislation on liability for the PSAP and really for 988 as well. There's a lot of work that needs to be done here. And then some state legislation on fees or authority and other things that, like AB 988 that the legislature is working on. And there's a lot of discussion on technology versus staffing. In the 911 space, the fees collected are not used for staffing. They're just used for technology that keeps the fee low and manageable. and puts the at the local level, you have the ability and the authority to hire whoever you want to serve your mission as you see fit. And that model would probably carry over into the 988 space. And there's been a lot of discussion about how the fee is billed and whether things could be brought in to the fund that are separate from the fee to pay some of these other resource needs that exist, like facilities and other equipment that the fee might not cover, or staffing, or those kind of things. So there's a very large conversation, I think, that's needed over some of these. And I think the outcome of that will probably really determine some of the successes on down the road. But these are conversations we're entered into now. Primarily, we're looked at from the 911 perspective as the technology folks. We do training. We provide some funding for training, and we set the standards and provide the equipment needed in order for the operational need to be met at the local level, and that everything operational is handled locally. That model's been in place in California for decades. It's proven very effective and probably would be a really good model to carry over into this other space. So any questions on that? All right. Let's see. So AB 988 would add a 988 phone fee. Yeah. So that's one of the things that's in AB 988 is a fee similar to 911. And it has passed through the different committees. It is a tax or a surcharge. It's not very big. Okay. It's 8 cents, I think, is where they start. So your phone bill would go up by 8 cents. How many of you would notice that? No. You're still worried about the extra $3 you're paying per gallon per gas from last year. You're probably not worried about 8 cents on your bill, but it is a tax, and there's a challenge associated with supporting a tax, especially in an election year. So a lot of work to be done here, but I think the lower that can stay, the more success this will have. And that's just my personal opinion, but we'll see what they do. I can't comment on it or anything. It's just, it's got to work its way through the process. Yeah. So this is where end state, and I'll end this, my last slide, I'll end with this and then open up to questions. What we'd like to be able to have is technology in place where the 988 person that needs help reaches the right center to get the right help that they need. So you all can do what you do best. And then if the situation escalates, or if it meets certain criteria that your call taker is trained to determine, you have a way to take that call with location, push it into 911 as a 911 call, and be routed to the right center with priority, because you've already triaged it. I already know this is an emergency because you've already determined that. We route it to the right center, and it interacts with the 911 system as a 911 call, preferably with location. And then from there, we can get the resources needed. And then we talk about the information exchange that needs to be between those two systems. Similarly, someone who calls 911 and it ends up being, no, you actually called the wrong number. You should have called 988. We can push it over there, because no matter what we do, people will self-select which system they come into. They could self-select 988 because they want anonymity, but what they really want is 911. And we know that that'll happen. They could select 911 because they think 911 will answer faster, or they will get some or do something, when what they really want is 988. Or they could just be kind of clueless. They just dialed the wrong number, and you've got to sort all that out. So, and we're seeing some success around the country, and I'll share a story that will probably resonate with everybody on the call, and then I'll stop and I'll answer some questions. But in Albuquerque, they had a call, mental health crisis, somebody naked on the roof, threatening to jump off and kill themselves, which is, terrible situation. That was a one-story house. So not really a huge life-threatening, nobody else was impacted, so all this is going on. They arrive on scene with a joint response, and they discover that the person on the roof has an outstanding warrant for their arrest. That triggers a very specific law enforcement response, because this is somebody who has a warrant and has to be arrested. But if you were to send in law enforcement to do that, you could have a potential negative outcome as this person responds to that. And so they walked through the scenario. The mental health professionals were there on scene, and they were able to handle the situation properly. They told the person, you're going to get arrested. It's absolutely going to happen. They totally freaked out. They were able to de-escalate the situation from there, get them down off the roof, clothe them, and get them the help they needed. And then, of course, because of the law enforcement, they did have to get arrested and get taken care of. But you can imagine that the outcome of that scenario if it wasn't done that way, and how potentially bad that could have gone, and how many more resources would have been needed to solve that problem if you couldn't have just talked your way through it. So those are the kind of outcomes that are promising that we hope to be able to work together to solve. And we're just at the beginning of these conversations. So really looking forward to how we can partner together and figure this out, even in the absence of funding or statute or laws or this. The reality is this is what you all are going to have to face every day as you try and provide the help to those that are in need of help. So I'll stop sharing my screen at this point and see if you guys have any questions for me.
Oh, she went to your convention.
Any?
I have a question, but I
Yeah,
don't know
go
if
ahead.
this is more so for like within CSS or for you, but I'm just thinking when we talk about this idea of transferring, I'm thinking of like two scenarios. One, like, does the counselor get to stay on the phone with the caller as we transfer to make sure that that transfer got completed? Is that an option? Because oftentimes, and what we've done historically is when we do have someone in crisis that is willing to participate with emergency, folks, we like to kind of all touch base at once. So I'm wondering if that's my first part of the question, if there's capability to be in on that call.
Yes, that is possible. And I think two different scenarios would need to be supported. There may be the need for a supervisor to do the interaction with 911 and then bring in the caller later. I think that and we can do that. Or like you said, you do, I think the term you all use is a warm transfer, where you bring yourself and the caller in to the 911 center and do a handoff of that. Both of those can be supported with the technology that we would be deploying. And we think both are needed. There's probably situations where you'd want both to happen.
Right. And then you kind of answered it, but my second part of the question is sometimes we have folks that do not want, like they're saying, I don't want anybody to come, but it's clearly escalated to a medical emergency, and it would not be the best outcome, or maybe they're not collaborative, like they don't want to be transferred over, but maybe we have someone else call. Do we still have the ability to call that kind of direct link? Because right now we currently call like the emergency police number we have, right? Like another supervisor would call, but like, would we have access to be like, hey, a supervisor calls that direct 911 number, that 10-digit number, and say, hey, we actually have someone there experiencing medical emergency, but they do not want to be transferred over.
Yeah, so it's that kind of operational need where what I do is I just write the functional requirement into the technology, and the technology supports it. So the technology would support both paths into the 911 system, and then you would just need to write local policy as to which path you're taking and when, and because that's a judgment call in the moment of what's going on, but both paths could be supported. So it's those kind of operational things that we would need to know to make sure that whatever we deploy from a technology perspective meets the need operationally and isn't a limitation, where today there's a lot of limitations that the technology brings in that we want to remove from the equation to really facilitate the kind of transfers that are needed.
Great. Yeah, thank you. And just to kind of, I guess, give context to folks in the room, I'm not saying like we think that there is a potentially life threat, like they've taken something, they've already cut, there's some action that got taken place. So that's when we would be like, okay, maybe we have to do something else. So thank you for answering that.
There's a question in the chat too.
Yeah, what resources will be available to 911 calls that are not an emergency 911 call? So I think the question is, if a call comes in 988, what resources are available from the 911 side if it's not really an emergency? Is that the call? Is that the question?
Jeanette, is that what you meant?
Oh, can you guys hear me? Because
Yeah.
I'm having a bad connection. Thanks. This is Jeanette from Alameda County Fire. I'm just wondering if a caller has called 988 and the staff is doing a fantastic job de-escalating the individual, managing the situation, what resources now with 988 will be available to those callers?
So in the near term, unless it's a locally available resource, other than upgraded technology, which we've gotten approved for, I can't think of any resources. I do know Health and Human Services is working on a strategic plan to help facilitate that. There is funding coming in, and it's going through that process. And they would be the ones to answer other additional resources. But from just a strictly technology perspective, that's the piece that we're trying to solve.
Yeah, and I'll answer like from our end, since like we're the ones that pick up the 988, like, right, because we're saying somebody called 988. The service they're receiving is really the same service they would receive today, let's say, before 988 is turned on, if they either call us directly on our local crisis line, or if they call the lifeline and get routed to us because of their area code. The only change is that we did receive some funding from behavioral health to expand our staffing in anticipation of an expanded call volume, and also in knowing that first-time callers are often higher risk. And over the years, we've already had higher risk of calls that we're noticing. So we are expanding our staffing here at Crisis Support Services in Alameda County to be available to increase our answer rate, which I shared at the beginning, from 80% hopefully to higher, so that there's not long wait times, and that when people call 988, they can talk to someone as quickly as possible. The national standard is 90% in under a minute. That's kind of what they're hoping us to hit.
Okay, thanks.
Yeah.
All right. Any other questions or comments or feedback?
No, this was definitely helpful. We really appreciate your time. Thanks for being here and providing kind of the information and kind of what could be in the works. And you have our contact. So in the future, if there's any opportunities for people to be part of various decision-making processes or feedback processes, we could always pass it on to this group here, because as you see, we have a lot of people who are engaged in wanting to make this work here in Alameda County, and we would love to be at the table as all of it gets figured out in the hopefully upcoming months.
Yeah, and that's one thing that, and those that are from the 911 community that are on the line can correct me if I'm not accurate, but we really try and work hard to collaborate, because we know we don't have all the answers. And whatever we do, whatever action we take, we want to make sure that it's beneficial for you all, and not just some great state idea where it ends up getting implemented and you're like, what is this? How is this helping me? So we're really want to engage with your community, and those that you represent and serve, to make sure that whatever we do from a technology perspective meets the need and really makes advances in what we're trying to do here. So really, that's our goal. And again, we may not get it exactly right the first time. We're going to probably come pretty close, but we'll just keep improving the process. Yeah. So, and I think you're right. The conversation, the collaboration, that's the key to that. So anything that we do, we'll reach out to your group and we'll say, hey, here's what we're thinking. And if you guys can give us some feedback, that'd be great.
That's awesome. Thank you so much for your time today. Take care.
Absolutely.